Hi everyone and welcome back. Again, my name is Robert Yang and today I will be going over the drug called Lovenox. The generic name is called enoxaparin and this is an injection drug. So I'm going to first go over the patient education. Before I talk more about the medication, let's look at what the medication treats. In this case, it treats blood clots. These are healthy and life-saving when they stop bleeding. However, they can also form when not needed and cause a heart attack, stroke, and other serious medical problems. Some causes include waxy cholesterol plaques that breaks open and blood that doesn't flow properly. In this case, I've given two examples, and they are atrial fibrillation and deep vein thrombosis. So if you've forgotten what these two are, you can actually refer back to my previous video when I spoke about Pradaxa. What is Lovenox? This is a blood thinner used to prevent and treat blood clots and only administered by injection under the skin. What should you tell your doctor before taking Lovenox? You should tell your doctor if you are allergic to pork products, if you have ever or had a low platelet count during past use of another medication like this, or if you have bleeding problems. How do you take Lovenox? This is given as a shot in the fat part of the skin on either the left or the right side of the belly. You want to give the injections at the same time each day and continue the medication until told to stop. Your doctor will decide how long to be on this medication. How do you take the medication in a pre-filled syringe? Do not get rid of the air bubble from the syringe before giving it. Do not remove the cap or cover until ready to use, and each pre-filled syringe is used for only one time. Then you want to throw away any part left over after the dose is given. How to take Lovenox, a step-by-step process. The first thing you want to do is wash and dry your hands thoroughly. You want to wash your hands for 30 seconds, then sit and lie in a comfortable position so that you can see your abdomen. After that, you want to choose an area either on your right or your left side, at least 2 inches away from your belly button. The way how you remember this is think of love handles. Clean the injection site with alcohol swab, wait until it dries first. Then remove the needle cap by pulling it straight off the syringe and discard it in the sharps collector. Hold the syringe like a pencil in your right hand. Now with your other hand, pinch an inch of the clean area to make a folder in the skin, then insert the full length of the needle straight down at a 90-degree angle into the fold of the skin. Press the plunger with your thumb until the syringe is empty. I recommend waiting about 5 seconds first. Then pull the needle straight out at the same angle that it was inserted and release the skin fold. Then point the needle down away from yourself and others and push down on the plunger to activate the safety shield. After this, you want to place a used syringe in the sharps collector. What do you need to know or do while taking Lovenox? You need to tell your healthcare providers that you take this medication. You may bleed more easily and need to avoid injury. You need to have blood work checked as told by your doctor, and if you fall or hurt yourself or if you hit your head, you want to call your doctor right away. So what are the possible side effects that you may experience? So side effects that require immediate medical attention include allergic reaction. This can be hives, swollen, blisters, swelling of the mouth, face, or tongue. If you're coughing up blood, you have blood in the urine or blood in the stool. If you're having weakness on one side of the body, changes in balance, or even blurred vision. And then other side effects that does not require immediate medical attention include upset stomach, irritation where the shot was given, and diarrhea. What happens if you miss a dose? You want to take the missed dose as soon as you remember it. If it is close to the time for your next dose, skip the missed dose and go back to your normal time. Do not take 2 doses at the same time or extra doses. How do you store Lovenox? You want to store it in the original container and package until it's ready to use. Store at room temperature in a dry place. Do not store it in the bathroom. Keep it in a safe place and out of reach of children, and then throw away any unused or expired drugs. And now I'm going to be going over the prescriber education. Pharmacologic category and pricing. So this is an anticoagulant. It is a low molecular weight heparin. And it comes in 30 milligram, 40 milligram, 60 milligram, 80 milligram, 100 milligram, and 120 milligram, and 150 milligram. And depending on the milliliter, it costs different. So for example, the zero point 0.3 milliliter costs $7.70. The zero point 0.8 milliliter costs $20.51, and then the 1 milliliter costs $38.46. Recommended dosing in adult. So I did not include a lot of the off-label dose. However, the ones that I've included in my presentation are the ones that I thought were more common. So the ischemic heart disease in acute coronary syndrome, non-ST elevation acute coronary syndrome, you want to administer 1 mg per kg subcutaneous every 12 hours and continue for the duration of hospitalization or until PCI is performed. In ST elevation myocardial infarction, you want to initiate the medication between 15 minutes before and 30 minutes after the fibrinolytic therapy. Patients who are less than 75 years of age, you want to administer a single IV bolus of 30 mg plus 1 mg per kg. This is a maximum of 100 mg for the first 2 doses only, every 12 hours. Something very important is that the first subcutaneous dose should be administered with the IV bolus. And in patients who are more than or equal to 75 years of age, no IV bolus is administered. You want to just give 0.75 mg per kg subcutaneous. The max is 75 mg for the first 2 doses only every 12 hours. And then the duration is going to be continued up to 8 days, minimum of 48 hours when undergoing reperfusion with fibrinolysis and until revascularization. For venous thromboembolism prophylaxis, medical patients with acute illness at moderate and high risk for venous thromboembolism. So you want to administer 40 mg subcutaneous once daily, continue for the length of hospital stay or until a patient is fully ambulatory and risk of VTE has diminished. Extended prophylaxis beyond acute hospital stay is not routinely recommended. In high-risk COVID-19 patients discharged from the hospital, you want to consider extended prophylaxis with a direct oral anticoagulant such as rivaroxaban. And then continue on venous thromboembolism prophylaxis and total hip arthroplasty or hip fracture surgery. It is 40 mg subcutaneous once daily or 30 mg every 12 hours, also subcutaneous, with the initial dose administered greater than or equal to 12 hours preoperatively or greater than or equal to 12 hours postoperatively once hemostasis is achieved. Optimal duration usually given for a minimum of 10 to 14 days and can be extended up to 35 days. For total knee arthroplasty, it is 30 milligram subcutaneous every 12 hours with the initial dose administered more than or equal to 12 hours preoperatively or more than or equal to 12 hours postoperatively once hemostasis is achieved. Again, optimal duration is minimum of 10 to 14 days and it can be extended up to 35 days. Now let's look at the treatment for VTE. Earlier I mentioned about the prophylaxis. This time the dose is going to be a little bit different. For DVT or PE, it is 1 mg per kg subcutaneous every 12 hours or 1.5 mg per kg once every 24 hours. For the duration, provoked VTE is 3 months. Unprovoked VTE or provoked VTE with persistent risk factor, this is going to be greater than or equal to 3 months depending on the risk of VTE recurrence and bleeding. For VTE treatment in patients with active cancer, the months 1 through 6, the initial is 1 mg per kg subcutaneous every 12 hours or 1.5 mg per kg once daily for a duration of 3 to 6 months. For the maintenance beyond 6 months, you want to continue only in select patients due to the persistent high risk of recurrence and those with active cancer. Now for VTE treatment in pregnancy, this is 1 mg per kg subcutaneous every 12 hours. Anticoagulation management prior to delivery is individualized. Options include replacing the UFH at 36 to 37 weeks gestation or extending to 38 to 39 weeks gestation in patients at very low risk of delivery while on enoxaparin. Discontinue enoxaparin more than or equal to 24 hours before delivery, and then you may restart more or equal to 4 to 6 hours after vaginal delivery, or more or equal to 6 to 12 hours after cesarean delivery, unless significant bleeding occurred. Total duration is at least 3 to 6 months with at least 6 weeks postpartum. Now let's look at transitioning from another anticoagulant to enoxaparin and vice versa. So in this case, if you're transitioning from therapeutic IV infraction infusion, you want to discontinue the infraction infusion first, and then begin the enoxaparin within 1 hour. If you're transitioning from enoxaparin to another anticoagulant, so in this case, if you're transitioning to the unfractionated heparin, you want to start the IV unfractionated heparin 1 to 2 hours before the next dose of the Lovenox would have been due. If you're transitioning to warfarin, you want to start the warfarin, continue the enoxaparin until INR is within therapeutic range. For the treatment of VTE, you want to overlap the Lovenox with the warfarin until the INR is greater than or equal to 2 for at least 2 measurements. Both of these must be taken 24 hours apart, and the duration of the overlap is usually 4 to 5 days. And then if you're transitioning to a direct oral anticoagulant, in this case, the Bigatran or edoxaban requires 5 days of parenteral anticoagulation prior to transitioning. The general recommendation is that you want to start the DOAC within 2 hours prior to the next scheduled dose of the Lovenox. So for the mechanism of action, Lovenox enhanced the inhibition rate of clotting protease by antithrombin 3, impairing normal hemostasis and inhibition of factor 10A. They have a small effect on the activated partial thromboplastin time and strongly inhibit factor 10A. It is derived from the porcine heparin that undergoes benzylation followed by alkaline depolymerization. Pharmacokinetics. The onset of action is 3 to 5 hours. The duration depends on the dose. For the 40 mg dose, it is 12 hours. The volume distribution is 4.3 liters. Protein binding, it does not bind to heparin binding proteins. Metabolism, it is hepatically via desulfation and depolymerization to lower molecular weight molecules with low biological activity. The bioavailability is 100%. The half-life elimination in plasma is 4.5 to 7 hours. And the excretion in urine, it is 40% of the dose as active and inactive fragments, 10% as active fragments, 8 to 20% of the anti-factor 10A activity is recovered within 24 hours. And then clearance is actually decreased by 30% and creating clearance of less than 30 milliliter per minute. What are some medication safety issues? So for the sound-alike, look-alike issues, Lovenox may be confused with Lasix, Levaquin, Levemir, and Lotronix. This is a high alert medication. The National Patient Safety Goals, it is contraindicated with people who have known hypersensitivity to enoxaparin, heparin, pork products, or benzyl alcohol. For the drug interactions, agents that may enhance risk of hemorrhage should be discontinued prior to initiation of Lovenox. If they are co-administered, they must conduct close clinical and laboratory monitoring. Some examples include other anticoagulants, salicylates, or even NSAIDs. And these are my references. This concludes my presentation. I hope you learned something today. Take care and be on the lookout for my next video.